and honoring gratitude that the land on which we gather is the traditional territory of First Nation elders and peoples who have lived and continue to live here and have cared for these lands. Zoom etiquette is always included as part of the agenda, and I don't think that I have to read that out. So I would like to have a motion to amend the agenda to put the update by the Ministry Integration Poverty Reduction Specialist, Victoria Barr, as the first report from members and guests. So I would ask for a resolution to adopt the agenda accordingly.
Karen Pratt, yeah, I'll second.
Okay, thank you. All those in favor? Thank you. So the next item of business is the recording of the adoption of the minutes of the April 21st regular meeting. A motion to adopt those minutes, and I can't see everybody, so.
I'll move that the minutes be adopted as read.
Okay, a seconder, please. Darren Pratt. Are there any errors or omissions? Hearing none, I'll ask for a vote. All those in favor of the minutes? Opposed? Motion is carried. And for those who don't have their video on, please, if you want to say something, just shout out and let me know, because I don't have the screen on for or the participant list on. So Victoria, I would ask that you present your report, please.
Thank you so much, Councillor Thompson. Appreciate it. Thank you for having me and inviting me to this meeting. I'm pleased to meet you all. I will just maybe share my screen so you can get a sense of who I am and what we're going to talk about. Oops, just one sec here. Okay. And then I will start the slideshow from the beginning. Still figuring out all this technology, hey? There we go. You see that?
Perfect.
Okay, great. Thanks. So again, thanks for having me. My name is Victoria Barr. I'm principal of a small consulting company called Level Up Planning and Consulting. We are based out of Victoria, Vancouver, and Edmonton. We are a small company that is operated and owned by 5 women. And we are focused on healthy communities, equitable communities, and yeah, building health and well-being for all, especially within BC, but also in Alberta. So I have been told I have about 15 minutes or so. So I have probably too many slides. So I'll go through some of them quite quickly, and feel free to jump in if you have particular questions, or we can just leave questions to the end, if that works okay, Councillor Thompson.
Yes, I think leaving questions to the end would be better.
Perfect. Okay, thank you. Okay, so a quick agenda. We are just again who we are in terms of the company and the project that we're doing. Talk a little bit about poverty reduction work in Canada, and the boundary poverty reduction planning in specific detail in terms of the project, so you get a sense of what it's about. A little bit about statistics around poverty within the boundary. And then I'll share a little bit about what works, and so you have some idea of where we could go from here. So again, we are Level Up Planning and Consulting, and I'd already told you a little bit about what we do. We have backgrounds in both community planning, public health, community development, communications, community engagement, all that kind of stuff. This is our team. In particular is I have a PhD in community planning and a master's degree in public health. And I've been a consultant for over 20 years and worked with many, many communities across Western Canada, as well as done some work around policy development in terms of the ministry, various ministries and provincial governments and the federal government and the World Health Organization, actually. And I also teach at the University of Victoria. So a little bit of background about the project, just so you get a sense of what we're up to. The first is that this is part of the Canada's poverty reduction strategy. It was a long time coming and came out in 2018. And this comes with some funding, but it basically outlines, why it's important to address poverty across the country, and helps to support helps to give some guidance around how to do that. Across Canada, there have been lots of different efforts. The dots, the red dots there, that's only some of the work that's happening across Canada. And it's actually, oh yeah, there we are, Southern Ontario is there as well. There's an organization called Tamarack. It's an organization that's based out of Ontario, but they're helping folks all across the country, including us, in terms of this work within the boundary, supporting us they share resources, they give ideas, we're all part of one network, and so we can all connect with each other and learn, especially within BC, learn from each other. It's awesome stuff. So there's lots of wonderful things happening all over the country, and we're all learning from that work. This is BC's poverty reduction strategy. This is where the funding came for this particular project. So this came out, I think, in 2019, and it includes funding for individual communities and regions to do poverty reduction strategies, and then to do some implementation of that work. So that funding came from the province to the Union of BC Municipalities, UBCM, and then in our case, UBCM gave some of that funding to the Regional District of Kootenay Boundary, who hired us to do this work for the poverty reduction strategy for the boundary. So here's the main objectives of what we're trying to do with the project. We're guided by a wonderful steering committee. And actually, I saw some names of members of this committee who sit on our steering committee for the project as well. So there's lots of connections and overlaps. And just to give you some idea of what we're trying to do, we've been working at this since about October, and the final product is due at the end of June. Here are 3 phases to the work. The first phase, which I'll tell you a little bit more about in a second, is about sort of the background pieces and trying to learn about what's happening within the boundary, and then also learning about all that other work that we can learn from that's happening across the country. We're just coming to the end of phase 2, which is the engagement phase. Again, I'll tell you a bit more about that in a second, and I'll tell you also how you can get involved at that level if you'd like. And then we'll be putting together the plan shortly and providing our steering committee and other folks within the boundary, service providers and others with opportunities to provide some feedback about the draft. So this first phase was finished at the end of December, and we did some background review of all the different things that are happening within the boundary to learn about that. We really hope to spend a lot of time on the ground, and actually we wrote that in our proposal. But with the travel restrictions due to the pandemic, we haven't been able to actually come physically there. I've been there. I've been to many areas, many communities within the boundary before, but we had hoped in this project to spend time with people. But unfortunately, we haven't been able to do that. So we've been spending lots of time on Zoom instead. Literature review, we also looked at what works. There's actually lots of research from all over the world about what works. And so we sort of gathered that information up and tried to summarize it. We did an environmental scan. We looked at over 25 different reports, similar projects, similar plans from across the country, focusing on rural areas and small communities. It's very different. You can't just take what's happening in Surrey or take what's happening in even Prince George and transfer it into the boundary. That won't work. We actually have to learn about rural areas, small communities, and then specifically what's actually characteristic, what's special about the boundary and the communities within the boundary. And we did a little bit of regional data collection to try to get a better sense of the background pieces and what's happening, who's struggling the most, I guess, within the boundary. So again, this is what we're finishing up phase 2. We just finished a community survey. We had an online survey that was that closed on Friday, the 14th of May, held through the engagement platform as part of the regional district's website. We have over 200 responses to that, which is great. It was very short. We asked very few questions, but then folks actually had an opportunity to share their stories and their ideas in detail, which was great. We also had some community volunteers, members of our steering committee, and other folks who volunteered to walk around with paper surveys and help people to fill those out in various communities. We had paper surveys available for distribution and to bring back in about 15 or 20 different locations across the boundary. So we have a number of those coming back. We don't know how many exactly, but we'll have those other reports as well. Am I freezing?
No.
Oh, okay, good. I just got a little message saying my internet was unstable. We also interviewed 40 people, roughly 40 to 50 people, in many service providers like yourselves. We've interviewed several of your members of your committee. I can tell from the list of members, as well as local government elected officials and other community volunteers. We've interviewed as many people as we can. But if you would like to be interviewed, you're more than welcome to connect with me. We're happy to have that discussion and learn of your ideas and perspectives. We also, we're in the middle of data analysis. We're pulling together all that information. We're trying our best to strengthen the voices of those folks who have lived experience of poverty, either in the past or in the present, to bring those voices, strengthen those voices, and really learn and honor those stories and those ideas and those perspectives from those folks. And we also held a regional workshop in the middle of March to get some better ideas of what sorts of partnerships are operating and how to best move forward, ideas for moving forward the plan is in terms of implementation. This is kind of the general pieces of what the plan will look like. We're just about to start on the draft of that now. And it'll be the earlier version will be ready in the middle of June. Gives you some sense of what it's going to include. And here's the timeline for how it's going to look. Okay. So this just gives you some sense of what we have learned in terms of the stats. I don't think this will surprise you much. A lot of these stats, though, are from the 2016 census, and we don't have much to go on, and that was a long time ago, and things have changed a lot, right? And so we have to take this with a grain of salt. What this tells me, though, is that the boundary does have higher rates of poverty compared to other parts of the province. That's not a surprise. And that there's quite a wide variety, like quite a wide diversity in terms of poverty rates and those things that affect poverty within the boundary. Different communities are experiencing different things. Again, not a surprise to you, I'm sure. Here's some idea of the best measure we have for poverty, called the low income measure. And it gives you some sense, again, of that diversity within the boundary. And resident core housing needs. Again, there's an assumption often that we think that renters have, in terms of income and that kind of thing, or have more struggles, not necessarily within Greenwood, as you can see here. So again, we have to really understand what's happening in each of these communities and support folks and meet them where they're at in these cases. Food insecurity, we don't have boundary specific data for this, but we do know that the Kootenay boundary area as a whole has one of the highest rates of food insecurity in the province. What works? Well, one of the things that we know from lots and lots of research over the years is that if we focus our energies on those green bits there, those what we call the determinants of health, those things that affect our health and well-being the most, we put the most bang for your buck is focusing on those things. So we do need to support folks who are most in need in our communities, but we also have to help change policies and change conditions as best we can, so that we prevent folks from ending up going to food banks and things like that in the future. We have to do both those things at the same time. And of course, we have to be aware of the various barriers that people have that have impacted their lives, their health, their well-being, their ability to prosper in our communities. And so that's really important, understanding those barriers, understanding people's individual stories and their experiences, and again, honoring those. So in terms of what works, one of the things we've noticed from all the other poverty reduction plans out there is that different communities define it differently. And so that's one of the challenges that we have, is how do you define poverty within the boundary? And is it possible to come together and come up with one definition that everyone can agree on? We need to support, follow the lead and support community organizations and champions, just like yourselves. All of you are doing such important work. And we need to, within the plan and moving forward, to make sure that the plan doesn't just sit on the shelf and actually has feet and actually ends up being implemented. We're working hard to try and find funding or funding ideas of where to apply, so that that we can put that into the plan. And so help the networks within the boundary who would like to move the plan forward or change the plan or do whatever you'd like to be able to actually address and eliminate poverty within the boundary. That would be the goal. We're trying to find funding to be able to do that, so that I know people's capacities are stretched as it is. But we know that supporting those networks, ideally with funding, will make a big difference. We also know that those most successful plans have components that, again, are part of those green bits and that rainbow thing that I showed you earlier. We know that that's important. So we have to be able to think about transportation systems, mental health services, housing and homelessness, food security, education and training, employment, all those things that make sense. We don't have to do all of them all at once, but we have to think about the various systems and how they work together. One of the ways that people have done that across the country, this is just an example from New Brunswick, is that they have formed these very formal networks and then have gotten funding for each of those networks. And those networks are multi-sectoral, people from education, economic development, transportation, local governments, health and social services, all of those folks together, school districts, all those folks together, forming a formal network. We know that works. So that's going to be one of our recommendations as well. And we need to think about, again, those equity considerations. Always be asking these questions throughout. The main question: who will benefit from a policy or a project, and who won't, who might be left out? That's hard to do, but it's important. We need to start with the strengths as well. This is Stewart, BC. Look at that picture, hey? Oh my gosh. So it makes me just want to go there very quickly as soon as just to explore the province a little bit more. But certainly their plan is really strong in the way that it focuses on those strengths. And when we've been doing the engagement for this boundary plan, one of the first questions we ask is, what are the strengths in your community? What are the assets? What are you bringing that will help we can capitalize on or continue to foster to what's the word? I'm trying to have a word in my head that I can't get out. Anyways, continue to support in order to be able to move the plan forward. Again, because we don't want the plan to just sit on a shelf. We want to think ahead how to implement it as best we can. Again, systemic change is really important. So these are some of the pieces that we'll be thinking of. These are sort of generic pieces, but of course it'll be, when we've got all of the data analyzed from our engagement phase, it'll help us to really understand, okay, different systems or different issues that we need to be focusing on specifically for the boundary. We actually have ideas for that now, but I don't want to share them with you yet because I want the steering committee for the project to hear it first, which they'll hear next week, actually. And then making sure that we're always evaluating and monitoring as much as possible. We need to understand what success looks like and then try to measure it so that we know we're on the right track as we continue on with the work. This is long-term stuff. It can't be fixed. You know, poverty cannot be solved obviously in very quickly. It takes long-term commitments. So we need to be able to evaluate that as we go through. Okay, that's it. Oh my gosh, breathe. So sorry, I hope that wasn't so fast that you weren't able to capture. I do have a couple of questions ready though, but Councillor Thompson, I'll take your guidance in terms of what you would like to do now.
You have questions from members?
I have questions for the members that I'm curious about, but perhaps I shall just take general questions from the members now, if that makes sense.
Well, if there is anyone that has a question, and I can't see everybody.
Oh.
Please.
I have a question.
I have a question too.
Okay, so that was,
too.
okay, now I can't, who was first? Kathy Hutton, was that you?
I think Janice was first.
And John, then Kathy.
Oh, okay. Tanis?
No, not me. This is Kathy, not me.
I just wondered if we could look at that graph, that housing graph, and if you could explain it a little bit.
Oh, okay. Sure, let me share the screen again then.
And also, Chris, Heather, Elliott, and Deb are supposed to be on the call, and I wonder if are they on there?
Heather is, but I don't see Deb. Unless
Is
you.
Deb with you?
Yes, Deb's with me. She's sitting
Okay.
just off camera, but I'll introduce her when.
Okay, I didn't see you. I just wanted to make sure you weren't in the waiting room.
No.
Okay,
Thank you.
I just didn't understand the housing graph, and I wanted to look at that again. There.
Okay, I'm sorry. I think my Wi-Fi is a bit unstable. Sorry, can you repeat the question?
I just didn't understand it, and I wondered if you
Oh,
could
okay.
explain it a little bit.
Okay. The gist of this is that housing trends and characteristics gives you some idea of the challenges that people are having in terms of affordability, and how that interacts with whether they own and whether they rent, of course.
Okay, okay,
So it's like the number of households that pay more than 30% of their pre-tax income on shelter. That's what core housing need is.
okay,
It's from the census. Again, this is old data. This is 2016 census data.
okay.
That's what it's-
Okay, I didn't see
Yeah.
the homeowners and renters thing under the heading, so I was looking at the graph and not making sense of it, but now I do. Thank you.
Okay.
I think John DeHaan was next.
Yeah, I've been taking notes. Thanks for your presentation, Victoria. Yeah, I've got quite a number of questions. I'm trying to prioritize here.
Okay.
I understand that you're at the end of your phase 2, as you described it. I'm right. Firstly, what comes to mind is you mentioned your regional data collection. What I saw was a survey. What I saw was interviews. And I imagine whatever is being handed off to you by your steering committee and census data. Is that correct?
Well, that's the census data is part of phase 1, which is like the background stuff. And I already spoke to the limitations of that. But the phase 2 is, which was the community engagement process. So that's like the interviews, the survey, the regional workshop, focus groups as well. And as I said, the survey was both online and through paper surveys and that kind of thing. And our steering committee was wonderful in terms of offering to help to gather ideas and perspectives from folks across the region.
With regards to the survey, you mentioned that you had some 200 respondents.
Yes,
Now, I suggest that I would imagine that the sample or potential sample would be all residents of the boundary, correct?
yes,
So that's 200 out of 10,000.
yep.
Okay. Now, given that, I'm cautious when we look at policy and decision making based on data collection.
Mhm.
I want to ensure that the representative sample is indeed representative of what we might, associate with the entire area, which 200 out of 10,000 strikes me as, it's probably encouraging to see 200 responses from your end, but I wonder about the validity of the data and whether or not it's quantifiable. Given that, could you give me an idea of what demographic your representative sample might include?
Okay.
Like who do you have any idea of who responded?
I can't tell you that yet because it just closed on Friday. So we're still gathering all the data and trying to understand it.
Okay.
But just in terms of the survey itself, we were not going for a representative sample. That wasn't the intent, nor was it in the intent to reach every single person within the boundary. That wasn't the intent of the survey. The survey itself was, it wasn't a bunch of like checky boxes. It was a lot of open-ended questions, maybe five, right? To get people, it was more about depth than it was about breadth. And that was very intentional, partly because of the pandemic. We knew that it was going to be difficult to reach as many people as we'd like, especially those folks, again, with lived experience who really, it's important to learn and understand their experiences and how they're living day to day. And so an online survey is not going to do that, right? So that's why we understood the limitations of the survey from the beginning. And we worked very hard with our steering committee, taking their advice and their ideas and using the connections that they had to reach out in other ways to folks across the boundary. So
Okay.
just so you know, that was never the intent of the survey, and that's okay. It's a valid research methodology to do it that way.
Yeah. No, I understand. I just wanted clarity on exactly or roughly what demographic it might represent.
Yeah.
You interviewed people. How would you describe that sample? Did you interview a lot of people?
Yeah. It was just over 40 people, and we're still doing a little bit of that too. So if you'd like to be interviewed, I'd be happy to have a discussion with you. I'd love to learn about your perspectives. We started with our steering committee and the advice they gave us in terms of different individuals who would have some ideas, some perspectives in terms of what are the key issues within the boundary. What are some ideas that folks had that particular things need to be changed or strengthened within the boundary to help to reduce poverty? What are the challenges that people or organizations are feeling? Those sorts of questions. What strengths do those organizations and individuals have within the boundary to help to achieve these goals together? Who's doing what? Those sorts of questions were all the questions that we asked. We focused at the beginning on service providers. And then we branched out a little bit. We also talked to some elected officials in local governments. And we also talked to, some folks working in places like in economic development and other areas of kind of community programming of that sort. So yeah, we've done our best to try to understand the different parts of the method, the survey, the interviews, the workshop. They all have different objectives. And they kind of fit like a pieces of a puzzle together to give you a whole picture of what's happening. That's the gist. So we're
I
trying.
appreciate
Okay,
your,
so in the essence of time, because we've about an hour and 15 minutes left of our meeting, and we've got several other reports.
Yeah.
Chris, was there anybody else besides John? I thought there was the third person that wanted to ask.
Yeah,
Mhm.
yes,
Oh, Anne? Okay, Anne, go ahead, please.
Yeah, I was just wondering, like, I understand that it's a real issue with housing and you're talking about more affordable housing. And yet we're looking at, you know, the fact that wood is almost as expensive as buying your girlfriend a diamond. So you're never going to get the costs down. So how do you perceive that you can come up with more affordable housing when the cost of housing is absolutely out of this world? Who gets to absorb all that cost?
Mm. Oh my gosh, that's a big question. Yeah, I can't necessarily answer that in a very simple way, but I know that like we have a housing needs report that's fairly recent that we can draw from, and we have other ways to better understand what can be done in terms of more affordable, higher quality housing within the boundary, which is obviously a huge part of reducing the impact of poverty and reducing poverty in general within the boundary. So that's kind of one of the, it's such a complex issue and I'm not sure I can give you a straight answer for it. But yeah, I agree. I mean, it's something we can't, like housing is such a key determinant of health. If you don't have good housing, it's very difficult to do anything or to be healthy in any way. So it's certainly.
I know, and that's the other thing to consider in all of this is that, you know, there's been, I think a lot of it was to do with the COVID, but, you know, people that were renters were told, well, they didn't have to necessarily pay their rent, but the guy that owned the place still had to pay their mortgage. And I think what we're seeing now, certainly in the boundary, is that there's even less rentals because people are getting out of the rental business. So there's an even bigger impact when you consider that, and you know the cost of building just keeps going up. So I'm kind of curious about how, you know, you figure you can pull that one off. The other thing I'm wondering is are you pursuing the concept of a basic income rather than having so many different groups that have different ways of supporting people to get to a basic income? Do you deal with the federal government or provincial governments on things like this?
I don't personally, but that's certainly something that we could recommend and have as part of the considerations that we're bringing forward. There's lots of wonderful work being done in that area. Basic income is a huge area right now, and it's something that like groups across the country and communities across the country and those networks that I talked about are definitely trying to figure out how that happens. I know that there are discussions within the province of BC too, and trying to figure out how the provincial government can support basic income. So it's definitely something to put into the plan as a recommendation for moving. We will, the plan itself will talk about recommendations for like local recommendations at that level, but we'll also, you know, how can local and regional governments and organizations and individuals advocate for particular policy changes or particular initiatives at the provincial and federal levels as well. So it's important to think about all those different levels and how they work together.
Okay, so Victoria, I know that there's probably many, many more questions, but as I said, how can people get in touch with you if they want to ask you a question with respect to your presentation today?
I did have at my last slide, should I put that back up? My email address on the last slide?
Yes.
Or I can tell you what it is and people can just send me an email. Does that make sense?
Sure.
Yeah. So it's victoria@levelupplanning.ca.
Okay. Thank you very much. That was an excellent presentation. Lots of good information that came out of it. Good discussion. And thank you very much. And you are certainly welcome to stay for as long as you can for the rest of our meeting.
Thank you so much. Appreciate it. Appreciate the questions too, and your interest in the project. And yeah, I might stay for a little bit if you don't mind.
Not at all. You're so
Perfect.
welcome.
Thank you so much.
The next item report on the agenda is an update on the shelter at Hardyview Lodge. So Darren, I think that would be you.
Thank you, Councillor Thompson. So yeah, we're continuing on. We had a meeting this morning, so we're averaging between 7 and 8 clients a week. We do know that there's been a dispersal through community of some of our clients, which is kind of back to sleeping rough again as the weather's improved. So yeah, that's kind of where we're at.
Okay. Okay, update on recommendations to council for a year-round shelter. So I believe, Chris, that was the letter that came from the city of Grand Forks. And as I did give you an undertaking at our last meeting, I would take these 2 resolutions to council, which I did, in the exact format that they were presented at the last Social Services Advisory Group meeting. The first resolution, and I broke it down into 2, Juliana. The council received the report on the recommendation that there would be a benefit for a year-round shelter. They received it as information. Yeah, the second resolution that asked the mayor to appoint a subcommittee on senior issues, that was amended to the resolution that you have on the before you. That Chris, if you can just bring that up a little bit. Your yeah. Now, I just want to give a background on that. If the mayor appoints a subcommittee on a specific issue, the majority of the members of that committee have to be members of council, which also requires staff time and resources. Council felt that it would be better if the advisory group supported or appointed a subcommittee, and that Councillor Baker, who volunteered to be a liaison to seniors, and I believe, Juliana, he met with you and Ian, that would be the best and most prudent way to go. So if anybody has any questions on that, in that regard, Chris or I can, Councillor Malzahn or I can respond. Otherwise, I would ask if there are any volunteers who want to serve on a committee of this nature. Juliana.
Actually, if I was going to wait for your old business at the number 5 there before discussing this, actually, Ian and myself just met with Councillor Baker just a few hours ago. So just got home. All this was explained by Councillor Baker. The motion, it wasn't verbatim, and the reason behind it. I guess I just wanted to explain that when I forward this recommendation for the age-friendly community for senior services, the intent, of course, was not for it to come back on this committee, because realistically, I felt that the appointment of a seniors committee was separate from the Grand Forks Social Services Group. And it was, in particular, it wasn't for the senior society as a whole, which I'm representing. It was for seniors as a whole. And so for me anyway, that was the intent, that we get a buy-in from other community members and not necessarily from this board, because I don't know that we have representation for that. I did explain this to Councillor Baker, and I don't know where you want to go with this. Perhaps there is a need for it at in this committee, and maybe there are volunteers. I think that sadly you probably are not going to find a lot of volunteers for a senior subcommittee from this group of individuals, which is why I was trying to outsource it through council to other community groups. Does that make sense?
John?
Yeah, thanks, Christine. Thanks, Juliana, for your efforts to meet with Councillor Baker on this as well. And I think Councillor Baker is in the gallery, so thank you for rising to the occasion as liaison. I was left with the impression after the last meeting that what Juliana was suggesting was that it be a mayor's appointed committee and that it involved a kind of a diverse group as they move forward with planning on seniors issues and the age appropriate community concept. That said, I had a question for the two councillors represented at the table here, and that would be, should a taxpayer come out of this, or sorry, taxpayer, I was staring at my paper. Should a committee come out of this meeting today, can we expect representation from City Council on that subcommittee?
If it's a subcommittee formed by the advisory group, then yes, Councillor Baker would be the city's liaison.
But no one that regularly sits at this table would volunteer to be on the committee?
Chair, if I
Councillor
might,
Walton?
I'm sorry, Chair, but if I might, you know, I understand. First off, the standing committee is a very formal thing. A standing committee really is basically two councillors and 3 or 4 other people. And it's becomes a committee of council, and with strengths and weaknesses. The idea of a mayor's committee, or this agency, not an agency, this advisory group has created effective subcommittees in the past that have had council input and have then taken their advice to council. And so I'm optimistic that a committee based around seniors issue made up of members of this committee and perhaps other community volunteers who are interested will be effective. You know, perhaps get the people together and let them put together a set of goals and objectives and a timeline, and come back, and you know, and then this committee can carry that advice forward to council. So in other words, I really think that a subcommittee of this group would be an effective way to handle this issue. And Councillor Baker has volunteered. I did make the point that I think 6 of 7 councillors are seniors. You know, and and as a very active senior in our community, I'd be interested in this committee and a subcommittee, and would do what I could to serve on it. Okay, thanks, Chair.
Yeah, thank you. The other thing I wanted to make clear, and I don't think I did, is that the resolutions in the letter are amendments to the resolutions that I presented on behalf of SAG. So what I presented, Juliana, were your 2 resolutions as you had written them out for the last meeting. And I put those forward, and these 2 resolutions that were amended, or amendments of those 2 resolutions, is the result of that and discussion. So if I was unclear, my communication skills were the best when I first brought this forward, I do apologize. So I hope that clarifies it for you.
Yes, it does. And again, having had a meeting, Councillor Baker also reiterated that. Now, I did give to him I've already looked at volunteer responsibilities that I felt would be appropriate for this committee, and I gave him that to share with council later, or that, and so I don't know if that it helps. I mean, I can read them out to you. Yeah.
No,
That's
that's
of interest or not. Okay, that's fine.
maybe you could share that in an email to the group,
Okay.
and we could maybe put it on the next agenda if deemed necessary.
All right, understood.
Okay. So are there any other questions on that? Okay, so then we'll move on.
I actually, can I back up a little bit? I just have a question for Darren before we move on.
Absolutely.
Darren, did you mean 7 to 8 a night
Yeah.
at the shelter? You said a week.
No, sorry about that. That was a night.
Okay, just wanted to clarify that for.
Okay, so I think now we'll move on to the update on the COVID vulnerable population. Darren,
So our
that's-
COVID outreach team is still out there. Again, we've had lots of disbursement to different campsites. So the guys are basically trying to just chase folks wherever they go to make sure that their needs are being met. I'd like to throw out a big shout out to Tammy and some other folks who've really been working to support my team with some food security initiatives and making sure that when my guys are going out, that they've got enough food to get out to our vulnerable population. So big thanks to those folks for helping with that. Any questions?
Thank you, and good work, Tammy. That's really good to hear. The next update is from Tanis on the coins.
Just busy. Everything's really busy, continuing with my regular work with mental health and substance use, and filling in for the Aboriginal Health Coordinator still until they hire somebody. And yeah, things continue to be busy.
Good. Good. Well, you guys are doing a good job, so thank you very much for that.
Thank you.
Is there anyone else that would like to give a report on what's happening? Heather, I see you.
Hi, so I know I'm just new recently to coming to these meetings, but I've been working as a community integration specialist for the Ministry of Social Development in the area now for almost 2 years. And I'm really happy to announce, because the boundary was somewhat, inaccessible, especially in the winter for me to really, I was spread too thin because of the range of my area. And I managed to lobby the government and get you guys a community integration specialist for the boundary region exclusively, who lives in the boundary. So I'd like to introduce her. She's Deb Pownell.
Hi.
Hi, welcome.
Thank you.
So Deb will be accessible through the Service BC office. She is waiting on cards because there was a bit of a mess up with her cards, but hopefully she'll be able to get out and connect with everybody soon. I've been taking her around to some of the service providers I've been working with in the past, and she's really excited to get going. And one of the things that attracted her to this program is the fact that it looks at case management model that originally, when she came to the ministry 30 some odd years ago, was the way they did things. And, you know, she's really happy to be able to go back and give that kind of service again. And, you know, so I'm getting her involved with this meeting as well, so she can reach out more, and you guys can reach out as well to her, so she can become more familiar with the area. As she lives here, she's not been from here for a very long time. So, you know, you might be able to assist her to become more familiar with the region's issues and what issues you face the most. So we're really excited because this is a great program with the ministry. It just started, what, almost 2 years ago now, and then COVID happened, and a big part of it is the face-to-face, so it's made it kind of difficult. But you know, we do a lot of meeting of clients and people who are faced with extreme poverty where they're at. We don't make them come into the government office. And that's the beauty of the program, because a lot of these communities are really kind of closed off, right? And you're not going to gain their trust by telling them they have to go to the government office.
Yeah.
So, you know, the ability to have technology now where you can sign right on the computer, you know, it's really helped us to help more people than ever before. So we're really happy about it.
Excellent.
Anyway, that's my bit.
So Heather, maybe you can make sure that Chris has
Yes, please.
Deb's email.
Yes, for sure, I will do so.
Thank you. And does that, in past, if an organization is allowed two voices at the table or two people at the table, but with one vote, basically, I would quite gladly send an invite to you both for the next meeting, whenever the group decides that is. Is that fair for you, Heather and Deb? Is that? And then you can choose who attends.
Yeah, so, you know, Deb is new to the program, so I will be connected with her for, you know, a while now, helping her to get sort of involved in the boundary region. And although she's been with the ministry for many years, so I don't think I'm going to have to tag along much, but, you know, yeah, if you could just do both of us for now, then, you know, we're good with that. But I'm going to be gone for 3 weeks, so yay me.
Thanks,
Are there
Chair.
any other questions for Heather or Deb? Okay, then Ally, I think you wanted to report something?
I did. Thanks, Councillor Thompson. I just actually want to let everybody know that this is my last meeting. So I will be leaving BWC at the end of May. We do have a woman named Pawnee Aguili who is going to be our interim executive director while we continue the search to fill my role. So we may not have a representative at the table for a month or two just because she is working remotely. I'm not sure what time commitment she has for us just yet. We're just sorting out those finer details. So we still want to be a part of the table. We still want a seat at the table. So if you guys are willing to still forward the minutes, that would be great. And we'll make sure that someone joins as soon as possible. So just wanted to let everybody know that update. And other than that, our services have been busier than ever. Our transition house is full. Our second stage is full. We continue to be busy, but our staff is managing everything very well. Yeah. And that's it for my update.
Good
Thank
luck
you.
on you. Good luck on your new journey, Ally.
Thank
Yes.
you.
And all the best in your future endeavors. Are you leaving town or are you just
I'm
moving?
Yeah.
Okay, good. Well, good luck.
Thank you.
Are there any other reports? Okay, so, oh, Tammy, yes. You're muted. I can't hear you. Now you're muted. Now you're unmuted. Nope, can't hear you.
Turn your volume up, maybe.
Oh,
You almost had it, Tammy. I think the device that your video is connected to is also your microphone.
Nope, can't hear you.
Maybe just yell.
Have you got a signboard? Write something.
Technology is wonderful when it works.
Check the chat.
Oh, she's chatted. Okay, can we double back to Victoria's questions? I don't have an issue with that, Victoria, if you're ready to answer more questions.
She had questions she wanted to ask us.
Oh, you wanted to ask us?
Yes.
Okay.
Does that okay?
Yes, that's just fine.
Okay, and you have time in the agenda?
Yes, we do, actually.
Okay. Let me pull it back up then and I'll show you. I will show you just one sec here. Okay, so I'll share my screen again then.
So I'm going to say we'll do this until 3 o'clock. That gives us almost 20 minutes.
Heads up, I'll be leaving the meeting in a few minutes.
Okay. So, Tammy, if you have.
Okay, can I start? Councilor Thompson? Yeah.
Yes. Okay, who's got a question? Now that
Can you
Victoria,
see my screen okay? Is it okay?
what should some of the key
I'm sorry, I think I might be freezing.
So who would like to take the first one? What should some of the key elements of the boundary poverty reduction plan be? So anybody wanting to respond to that? Don't everybody put your hand
How
up.
about funding? I'd like to know where the funding is going to come from for all of this.
Okay. As I said, we are on the search for funding opportunities that will definitely include information about that and that kind of thing, so that that applications can get ready and you can see where the possibilities lie. So we're on the hunt.
How
That's a
about
good question.
coordination of services? If we all work together, we're stronger.
Yes, I don't know who said that. I'm sorry, I can't see your faces very much, but I appreciate that. I agree with that. And as I said in my presentation, there, we have examples now, successful programs. Ontario, some of those programs that have been running now for 5 years or so have seen a fairly significant reduction in poverty in their city or in their community. And one of the key things they did from the very beginning was to talk about the coordination of services, which is why my second question says we need to develop a network, a strong network, and come together. You definitely stronger together than you are separately. Thank you for that.
Can I jump in?
Yeah, absolutely.
Sure.
Okay, thank you. When I look at key elements of a poverty reduction plan, I can't help but think that there's a direct correlation between poverty and poverty reduction and employment opportunity in the boundary. Now, with regard to the boundary, there's quite a bit of employment opportunity when we look at it, but often those jobs are in the agricultural sector. They might be seasonal. but I won't get into detail. I guess what I'm trying to get at is that will an employment component play a role in this plan?
Yes, definitely. I mean, obviously that's key. Because, obviously poverty is significantly about income, not totally, but significantly about income and employment. And not to mention the fact that it's not just about getting money coming in to put food on the table. It's actually helping people to find work that is satisfying and helps to connect people together. And, so the other pieces about working besides just getting the money for it, and to think about that too, because we're thinking about community well-being as a whole, So thank you. Yeah, that's definitely going to be a part of that, and which is why we're connecting with economic development folks and trying to understand better about what's happening within the boundary in terms of employment opportunities.
That was more where my question was focused, was I guess what sort of liaisons have you created and what are we looking at down the line with regard to economic development? And, I'm pleased to hear that you've connected with some of those people already, but I guess my main point is that it seems to me that it's a very important piece and would be of any poverty reduction plan. So thank you. Yeah.
Okay, and I
Yeah, for
see that
sure.
Tammy has sent me a chat that in her response is community inclusion, reconciliation, equitable housing opportunities.
Mhm. Yes, I'm writing all this down. Yes, one of the things that we, am I freezing again? Sorry.
No, you're good.
Okay, thanks. One of the key things that we do as an organization, as a company, as a group of people working together as a partnership is we focus on equity and incorporating that into everything that we do. And so inclusion, reconciliation, equity is totally a part of everything we do in terms of how we think. So that's definitely front and center. In fact, it's a huge part of the roots of poverty. Actually has to do with people being excluded from society in different ways. So yeah, thank you for that. Appreciate that, Tammy.
John, did you have any other questions?
No, I'll leave it at that for now. Thank you.
Chair, if I might,
Yes.
if I might, just my advice to Victoria is some of the key elements are already in place throughout our community. Whether it's this table or the people at the food bank, or even the merchants, the DBA or the Boundary Country Chamber of Commerce, whatever. Yeah, so please, some of the key elements should be what's already in place. This group has been working hard to establish itself as a network to address social services in our community for 2 years now. And it has had an impact. So, my advice is use what's working and what's there. Thanks, Chair.
Perfect.
Okay, so moving on to the next question. We are going to recommend that a network be developed to implement the plan. Who should be part of that network? And I have question 3, board fatigue, that's question 3, sorry. Tammy, you didn't have a comment on the second one? Okay. So does anyone have a comment for Victoria on who should be part of that network?
I'd just like to know who you're already working with and networking with. You must have a list of people you're already starting to work with.
We have a list of different organizations that we've already connected with through the engagement process, like through interviews and other ways of connecting with people. And I don't have that off the top of my head, but many of them are the organizations that you are all representing today, as well as, libraries, and community futures. Sorry, I can't think right now. I don't have the list with me, but we do have at least 20 different organizations that we've been connecting with thus far. But it's the thing about it is we're consultants. We're meant to come in for a short period of time, help to sort of plant the seeds. And then, but this is a much longer term process, of course. And so we're trying to find ways to was suggested before, to not reinvent the wheel, to strengthen and learn about what's happening already. Of course, that makes tons of sense. And then also to help to foster ways to build on those already existing networks in order to get different sectors connecting together around poverty reduction. More formally.
Have you made contact at all with the Boundary Country Regional Chamber of Commerce?
No, but that has been recommended. In fact, just earlier today, that was recommended to us again. So thank you. Yes.
Okay.
Okay, good.
And what about the Legion?
Great idea. Yeah.
No, actually, the Legion has not come up. Okay, that's great. Thank you.
Anybody else have any suggestions for Victoria?
What about the Masons? I'm not sure exactly what they do, to be honest, in town, but I know they have a building, so they must do something.
They do,
Okay.
but I am not 100% sure if that would fall within their jurisdiction. George Manson is a friend of mine that I know, and I can touch base with him if you like to. And I know Everett Baker is. No, he's not a Legionnaire or a Mason. He's a Legionnaire. Let me touch base with George, and I'll get back to everybody on that.
I have one more question. I'll make it quick.
Mhm.
Victoria, one thing, and this is an observation, but I don't think we disagree at this table, that we keep seeing an influx of people to the area, which I might term as being urban refugees.
Yeah.
They've had to leave for one reason or another. They come to us without employment and without housing,
Mm-hmm.
and in a lot of cases without any support network whatsoever.
Yeah.
I think it's fair to say that we're seeing more and more of this.
Mm-hmm.
And it's always struck me as being rather, I don't know, I'm looking for the right word, unfair, I guess, to the area, that we're absorbing the slack on this thing as urban centers reach capacity.
Yeah.
That said, it's creating a situation where maybe the numbers end up being disproportionate in our part of the world here.
Okay.
And that we tend to be looking towards government for more and more resources to try and deal with it. That said, it's problematic. And obviously it would factor into what you're doing as a situational thing. So given that, we have this business of unemployed people coming here with no means of employment, no support network, no housing, no resources, and more and more eyes turned to government to solve it? I know it's a big question, so I'm not expecting the solution from you at the moment. But your thoughts on that? Are you agreeing with me that this is a concern and something we need to be looking at?
Oh, definitely it's a concern. It's a theme that has been brought up many, many times, that we've heard that before from other people. It's, it's a very complex thing, as you've mentioned, because, my understanding of those folks that I've met from the boundary are very kind, compassionate people who would want to be a welcoming community for others to join part of the community. But at the same time, if the services, if the capacities of the community are not there for the, then having more folks come in that does strain that, then I can understand that for sure. So it's complex, and it's another example of how you can't create a plan for the boundary in a vacuum, right? Because what's happening in other parts of the province and other parts of the country in some cases are going to affect you, and vice versa. So we have to be thinking about all those different levels and what's happening in order to create strategies that will work. So I
ask a question, because Darren asked it in the chat. I just would like to know where you're getting the stats to support this, John.
Where I'm getting the stats? No, that's just my own observation. Like I prefaced my statement with that. It's an observation, but and I begged your indulgence by saying that I think that most people would agree that we are seeing this. I'm seeing a lot of new faces around town. That said, I'm sure some of the other providers here could add their thoughts on it, but that's been my observation. I don't think I'm alone in saying that.
Well, I just want to add that I do speak to homeless and challenged people all over the boundary region. And the vast majority are from here. You're just seeing more of it now because they're becoming homeless due to the housing crisis.
One of the things that I might be able to help with that a bit. There's a Facebook group in town called Ask Anything or Ask Away or Ask Something anyhow. And that's actually something that I've noticed in the last probably a month or two, anyhow, maybe more. There's more and more people showing up on that site going, hey, I just thought I'd move to your area. What's around for rentals? Anything in jobs? I just think it looks like a good place to live. And I figure we're getting 2 or 3 questions like that probably a week popping up on there. So I know it's not statistics, but it certainly is an indication.
Okay, Darren, you had your hand raised.
Yeah, I guess I worry when there's a conflation of opinion with data. Just because somebody posts on Facebook, I would be interested to know what's available. My team isn't seeing any change. We have not seen an increase in our homeless population for outreach. Tammy, I'm going to guess from your head shake that you're not seeing an increase in uptake at your facility. So I just want to caution the table that this is a slippery slope, especially when we have an external consultant who's here to help provide some solutions to some very entrenched problems, that this doesn't become a rabbit hole that they focus on. Again, there's been a lot of rhetoric thrown around this table in the last 2.5 years, and to be quite honest, it's starting to wear a little bit thin. I don't come here to listen to people's opinions. I come here to get facts, and that's kind of why I'm here.
Okay, so now time is of the essence again, and Victoria's been very kind to stay. We still need to deal with the third question. And that's a lack of regional representation on our regional issues. our community silo, and this could present a barrier.
Oh, question from Tammy. Is that what you're,
Yeah, and question 3, one of her comments was board fatigue regionally.
yes.
So Tammy, have I captured that?
Mhm. You know, I thank you for Tammy for offering that question. One of my observations is that, you know, we were hired to do a poverty reduction strategy for the boundary. And not surprisingly, there's a different, there's a lot of diversity in terms within the boundary. There's a lot of diversity in terms of issues and concerns and different types of what I would call community health and well-being issues amongst the different communities. And there's different people, different pockets of people, some volunteer, some paid within those different communities, but not as much regionally in terms of the boundary itself. And so that makes our job a little bit more difficult because it's like, okay, so what's happening across the boundary? Is there a way to sort of strengthen those bonds between each of the different communities that are working within the boundary so that they're more collectively working together? Because as somebody said, I think it was Tammy said earlier, you're stronger together than you are separately. Especially if you've got folks who are moving between communities, you know, either temporarily or permanently. So, you know, there's something about that I think we need to explore. It's one of the things that we're going to talk with the steering committee about to get the ideas about how to do that. But that's just my particular observation, just to reflect on that question, Tim.
Chair,
Okay,
may I,
yes,
if I can, I think I have my hand raised. Anyway, Victoria, we are in a bit of a convergence of views here. And you said so yourself at the beginning when your data was based on the 2016 census.
Yeah.
Besides your project, the regional district also did a report on housing.
Yeah.
And I'm sure you have seen it. I've tried to share it with this group. Basically, it's dismal.
Hmm.
It says that we're going to have a surplus of 250 houses in 10 years. Something like that.
Mm-hmm.
Well, that runs counter to what we're all observing right now.
Right.
We're seeing an influx. We're seeing a building boom. We know we're part of the whole province has got erupted in building. It's not just us, but it's certainly us too.
Yeah.
So in response to what John said about the newcomers, I would like to say that, yeah, there's a lot of newcomers, but unfortunately, a lot of them are my age.
Yeah.
And that is basically a benefit somewhat to the economy. These people don't work. They come with their own wealth. They buy a home. They don't really necessarily add to the employment base because they bring their own income, their pension,
Mm-hmm.
right? And they also, as newcomers, they often bring their own expectations. This is the way we did it back in, why don't you guys do it? Anyways, we have this convergence so based on what we're, I know it's a divergence, based on the 2016 census.
Yeah.
We're all going downhill.
Yeah.
And what we're seeing an influx. We're seeing build, all sorts of strangers. Anyhow, so that's part of a thing to your question 3. What's a barrier? Well, one of the barriers is we've seem to have a divergence between experts. Anyway,
Yeah.
so
Yeah.
that's my response. Thanks, Chair.
yes, and Tammy did also have a comment that in her lived experience, Boundary Family Services has had a successfully regional approach to their services for 20 years. And thank you for showing us how.
Nice. Yes. Okay, great. Just to answer the question about the comment, I guess, to reflect on the comment about the housing needs report and the census and that kind of thing. Yeah, as I said in my presentation, the 2016 data, that's what we have to go on in terms of census data. And we don't have lots of other data that is available for the region, for rural areas in general in BC, to tell you the truth, where it's difficult to find that kind of, those sort of numbers that we can go on. That's one of the reasons why we in this work that we're doing with the boundary and the plan, we've actually de-emphasized the data. We didn't spend a lot of time on the data because we realized that it was really incomplete. It was out of date. And we spent a lot more time and a lot more energy talking to people, trying to get a sense of what's going on. People who are living it every day, like yourselves and lots of others. And so that's what we've been putting our time on, because it's, I kind of hesitate even to present the data I did today, because it's, I know that it's not necessarily accurate about what's happening right now, especially since the pandemic, which has just changed so many things in terms of how we live our lives, and including, you know, specifically housing in your area. So we're trying our best to be up to date as we can, and to follow the advice of folks like yourselves. Yeah, but I agree with you. I agree with you that we have to work for now, and instead of looking backwards to what it might have been or was at one point, which again is not super valid right now.
Okay, and this is going to be the final one, because we do have some other business to take care of. But Victoria, Melissa from the Whispers of Hope inquired if the local vital signs report that's produced by the Phoenix Foundation, is that useful if not already used already?
Totally. Thank you for that suggestion. And that was the very first thing we ever read.
Oh, good.
It really was.
Good.
It's awesome. It's very helpful. And we've definitely been using that. The way that it's approached and that kind of thing is wonderful. So yeah, we've been using that since the beginning. Again, that's also because of the dynamic nature of the world right now with the pandemic. Things are changing so quickly, and so you have to take that data with a grain of salt too, because of that, right? But yeah, thank you. We have done for sure.
Well, Victoria, I really, really want to thank you on behalf of our advisory group for taking your time today to make your presentation and to enter into dialogue and answer and ask questions. And I hope that you found our discussions of benefit.
Oh my gosh, yes. Thank you so much to you, not just for the time, the feedback and the ideas and the questions that you've presented here today about this project, but also in general for your work in the community and the way that you support others is, yeah, I respect you immensely. Thank you so much.
And thank you. So we've got an item of business under old business, and that is the establishment of a seniors subcommittee and first meeting date. So Juliana, I'm going to let you take the lead on this. You're muted.
Well, as I said, because that wasn't the intent of my report last time to do a subcommittee for this group, but having heard the information from council, and that if there were people from this group wanted to do a subcommittee, it would be based on, it's not for the senior society, it is to help implement and form opinions about an age-friendly community for Grand Forks, so for all seniors, you know, opinions or things that we may have that we can, recommendations that you can put forward to council, like for example, the letdowns aren't clean, or you know, require more maintenance by the city. That's just one thing. So that type of information going forward. So yeah, I mean, I would take part in that committee if there were others that wanted to join as well.
Anybody else have comments on that in that regard?
Chair, if I've already indicated that I would be part of that subcommittee. And Mr. Pratt, Darren, you know, Rachel Warner was presenting on this in the previous meeting. Would there be, do you see there be of use to Boundary Family Support Services if she or someone else from Boundary Family Support Services was on the subcommittee? That's my question for Darren. Thanks, Chair.
Oh, thank you for that, Councillor Moslin. No, we would gladly participate as part of our service delivery stream, and we can only get the answers if we're in a position to be able to ask the questions. So yeah, no, whether it's myself or Rachel, I'll leave that to Juliana to decide who she wants to throw under the bus, and we'd gladly do that.
Okay, well, that's encouraging. You've got three volunteers, and Councillor Baker as your city liaison, if you so choose. So that's 4. And I might suggest that, sorry.
Oh, sorry about the dog.
If you, you know, if each of the members that have volunteered could reach out to people that they know. I don't know how many you believe would should be on the committee. So we're sitting here with 4, and I don't know how many more would be of benefit to the committee as a whole. So again, Juliana, do you have a number in mind?
Actually, I don't. You know, what I can do is send out email to the individuals that have indicated they're interested, and then can decide who from their organization they would like to send, and you know, to yourself, Councillor Moslin and Councillor Baker, and I believe that and Taylor from the Senior Society would most likely be on that committee as well.
Mhm.
And I mean, we could just take it from there, you know, put it out to any of the organizations here if you feel it would benefit to you to be on a seniors committee to help the seniors in the community. Just reach out to me via email, and happy to send you the information.
Okay, but this committee that's being discussed is not going to be a subcommittee of the Grand Forks Social Services Advisory Group.
No, it will not. And what I'll do is send information. We'll set up a separate King A and all the rest of it. And I'll probably start through email first and see where everybody's available. So
Excellent, excellent. Thank you very much. Is there any new business that needs to be brought up today? Darren.
As I'm sitting here looking at the dwindling faces at the table, I would really like to encourage us to reach out to our former participants and ask why they're not here anymore. We've lost some really valuable voices at this table in the last year. And Melissa asked that question, I think 3 or 4 meetings ago, of why are they not here? And I think that if we want to keep this table alive, we need to go back and engage with them and ask them why this hasn't become something that fits with either their mandate or their passion or their willingness to participate.
Yeah. Well, I know with Sergeant Pepler, he is not permitted by the RCMP to participate in Zoom meetings. So that's my understanding at any rate. But I quite agree. School District 51 isn't represented. The Downtown Business Association isn't represented. The Phoenix Foundation.
I can speak to the Phoenix Foundation. Alan has had some medical challenges, so he will be back, but it's going to take a while.
Okay. Okay. Well, that's good. At least we know there is some interest there, but if he can't, perhaps he could appoint someone else to attend in his stead.
I could
And-
talk to him about that.
Yeah, yeah. And Habitat for Humanity. I haven't seen anybody from Habitat from Humanity here.
Bob has retired. And so I don't know that Bob really had it on his list of priorities when he left to get somebody else involved. I could also put a feeler out there if you like.
That would be good. I appreciate that.
Okay.
So there are no late items. Anyone want to discuss the next steps? I think Juliana's got a handle on the seniors thing. And
Christine, I have another question that might fall under this category,
okay,
or maybe a suggestion, and it ties into what Darren had mentioned as well. Insofar as people that have kind of dropped away from the meetings, Darren in particular, do you have any suggestions as to possible additions to the table that people that haven't been included that you think maybe should? You know, since we're looking to talk to people. I've got Al and Bob on my list, but are there more?
Well, I think if we look back, adult mental health no longer comes to the table. Interior health management no longer comes to the table.
Okay, I can address the mental health as well. That's Bev. I can talk to Bev. Bev's been with us though, Darren, quite regularly. I don't see her today, but that's an exception to the norm with her.
And I think if you go back and look at the minutes, we had a pretty big gap where we went from having regular participation of a lot more members than we do now.
Yeah, no, that's right. But so I'll put Bev on my list as well. But yeah, Bev did. She wasn't working for a while, and so when she started back up, she rejoined us here. So that that's the explanation for the gap. But I'll reach out to her if you like.
I guess for me, Mr. DeHaan, my concern is that when an agency doesn't deem it important enough to delegate somebody to sit in place, to me, this is important. So if I'm not able to attend, I have a second and I actually have a third who would attend in my place. And my concern is we have community partners who are now really so disengaged from this process that if it's a warm day and they're on the links hitting the ball, nobody is in here in their stead.
Yeah.
And that to me speaks volumes of their level of commitment to this table and the value that they do or do not see in what it produces.
yeah.
So then could I suggest that in, simply that I'll go farther than to just ask them whether or not they will be attending, but I'll ask the whys here and ask about the possible appointment of a second so that there's more continuity.
And I see that Heather has her hand up.
Yeah, because I sit in different areas in both the Kootenays and the Boundary, I have noticed, like, since COVID, this sort of disengagement of interior health and mental health on a large scale all across my areas. I think part of the problem right now is there's a lot of reorganization going on. Like initially it was COVID, but now there's a lot of reorganization and, just, I'm not excusing it. I just see it in every one of these groups. So, it's frustrating because they really are key players in our communities and they really do need to be brought to the table. So I think it's incumbent upon us in a meeting like to get the encouraging emails or whatever we can do to encourage them to return because they really are integral in what we do. So that's my little 2 cents.
Thanks.
I'm curious, we had, Bev was she was representing mental health, correct?
That's
But
correct.
I don't think we've ever had anybody from interior health, have we?
Yes, we have.
Okay, and what happened
We
to that?
have on occasion, yeah, we've had, interior health has come and gone, but they've kind of said right from the get-go that, you know, they're kind of showing up on an ad hoc basis where there's an issue that directly involves them. Now, we might argue that all the issues directly involve them in a sense, but they've only shown up really where there's been something on the table that, you know, we need an answer from them about. But you know, since I'm doing this, I can reach out there as well. I'm happy to.
Again, like Darren said though, that I have seen like in Trail where interior health shows up at every meeting, they're sending like one of their young nurses, like their street outreach nurse, you know? I mean, there are people on the totem pole that could come to the meetings despite how busy they are. So again, I just think it's worth, you know, putting your voices together always is much better than just, you know, hoping they'll come to the table.
Yeah. Okay, there's a couple of comments that from Tammy that she's been advised that that maybe the time of the meeting and the use of inappropriate labels is a barrier for some. Do I have that right, Tammy?
Mhm.
Yeah. And from Juliana, which is a good thought. Do we have anyone, or should we invite the food bank and Rotary to attend our meetings? And maybe we could put that on the next agenda, Chris. And I think that's about it, because yeah, have I missed anything I should be saying? Oh, okay. Sergeant Pepler had sent us a training manual to educate on correct terms for people groups. And that's true, he did.
Mhm.
I have a copy of that on my desktop here. So,
Chair,
yeah.
recognize Darren. Darren has his hand up.
Oh, I'm sorry, thank you. Darren?
Thank you, Councillor Moslin, Councillor Thompson. I think that my perspective on this, when we started this table, we wanted interested, dedicated partners to come to us. We never, I think, started this with the intent of chasing groups in the hopes that they would come to the table. We wanted active people who felt that they had something to offer and they wanted to be here. So I don't know that there's really a necessity to be running around community chasing new members. We should really be asking why our founding members have walked away from us. That's my bigger concern.
Yeah.
Because those were the ones who came to the table saying, we're here to be part of the solution. What can we do to help?
Yeah. Yeah, and Heather has commented that many other groups have training for these types of groups, as well as such as the Trail Fair and what they call navigator training. So I don't know, Heather, if you wanted to speak to that.
Well, yeah, like it's, you know, there's also like the RCMP have the real strict what they call ICAT training, which is working with abuse cases with victim services, and it covers all sorts of guidelines. Navigator is just the name for what Trail Fair Association calls their table. They call it a navigation table. There are other areas where they call it a situation table or a smart table, where, you know, community organizations come together to help resolve some of the issues that poverty and low income and stuff like that present. And you know, there's a very distinct set of kind of rules, and usually they come up with an agreement at first and whatnot as to what types of rules we would like, you know, like that we respect each other, that we speak in only certain terms, that sort of thing. So, you know, and confidentiality is a huge part of that as well. And I think also with interior health and mental health, confidentiality is such a big issue these days. You know, even myself in government, it's a system that's hard to navigate, because I also find that it's also an excuse a lot of people use for not engaging. And we can't help as a team, which people need teams. They don't just need you or me or Darren, they need us all. And the ministry is really invested in pushing this kind of hub model that brings teams together. So somebody who's really experiencing trauma in community can come, maybe tell their story to me or Tammy or Darren, and then we can share the issue and try to figure out what the best way is to help that person or that group. And I think that's what these tables are about. The ministry also has a view that we're not here to police our system. So even if we learn information in these kinds of forums that might adversely affect the file of the client, we don't allow that to go that far, because that's not the point. If we had these meetings and these meetings are to be successful, we have to let it be known that that's not the point. Is do no harm is the point.
Yeah. And Tammy has a comment also that respectful language has not always been a part of this table in the way that it is now. And those who left the table may not be aware of that. So, okay, it's we've got 4 minutes left. Sorry, did somebody?
Like your phone.
I'd just like to make sure that I'm on the, seems to be a kind of a sensitive topic in view of what Darren has brought forward. Is the table okay then with me having a follow-up with Alan Cooper regarding the Phoenix Foundation and their position? Bob Huff to see if he has got a replacement to come to the table, or am I soliciting in that case? Should I leave it alone?
Chair?
Bev McCormick with regard to mental health, who is not with us today, but was at the last meeting. And then interior health, should I just forget about it or go ahead?
No, I think the fact that these are groups that have been and formed a part of our advisory group. And if you have contacts and are able to make, you know, get a hold of them and find out what if they have an issue and if they want to, that would be terrific. I think Darren's issue, and correct me if I'm wrong, Darren, was with us approaching Rotary and the food bank to join. And I think that's where his concern was. Darren, is that, did I hear that right?
Yeah, I think rather than chasing new members, we should really have the conversation about why hasn't this worked to date with our founding members? And then, you know, if throw it out to the food bank and Rotary of we exist. Not everybody knows we exist.
Yeah.
And then if they come back with, wow, do you know what? It's like Juliana in the seniors group. They found out we existed. They audited a couple meetings and they said, hey, we want to be part of this. We should have a voice at this table. We bring value to this table. We want to join.
Yeah.
Okay, I just wanted to make sure that was okay with everybody. Have I got the table's blessing? Then I don't want to appear as if I'm chasing anyone down here.
Just, John, just,
No, I don't take it
I can
wrong.
give you contact information, especially for Elaine Pura of the new executive director of Habitat for Humanity. I'm Chair, I just want to point out that right now there are 10 different groups on the screen.
Yes.
And that we should be talking what has worked. To me, this group has worked. Yeah, groups fall off. If you've been in this small town, you know it always boils down to 4 or 5 people. But I'm looking at a table that's still got 10 groups represented right this minute. And yeah, I know Sergeant Pepler has technical problems. Interior health got me. Let's talk. I really think the school district should be here. I think there should also be room for the food bank because they're providing a very important social service as well.
I can
Nonetheless,
speak.
I am optimistic that the group is effective and will continue to be effective. Thank you, Chair.
I
Very
can speak to Anna then as well at SD 51.
Sure.
Okay.
Because there's been a suggestion from Tammy that our secretary, recording secretary, send a "we miss you" and would like feedback letter
Okay.
to the ones that are missing. And Darren thought it was a good idea. Then it is the group requesting and not an individual member. So John, that would take you off the hook.
Oh, I'm fine with that. I was just offering, you know,
Well, and that's appreciated very much. But I think this way it comes from the Social Services Advisory Group. And if Chris doesn't mind taking that on, that would be great.
Okay, Chair.
It's 3
I
o'clock.
agree. I'm all for it.
It's 3 o'clock. Is there any other business that we need to be addressing? Okay, hearing none. Our next meeting is scheduled for June the 16th at 1:15 via Zoom. Can I have a motion to adjourn? Tammy, seconder? Heather, all those in favor? Meeting is adjourned. Thank you, everyone. I'll see you next month, if not before.
Thank you, Chair.
Thank you for chairing, Councillor Thompson. Much appreciated.
Thank you. Have a great day, everybody.